something about the UK variant. That's where it probably kicked off. But they were able to manage because they were getting their people vaccinated. And Israel's able to manage because they're getting their people vaccinated. In other parts of Europe, there's still some vaccine hesitancy, much lower levels of vaccination. So that just reminds us, as you look what's going on in the bifurcated Europe, how important it is that we continue to maintain our vaccination efforts. And I'll tell you why we remember. There was a really good piece by Ken Dixon signaling it was exactly 1 year ago that we had our first Connecticut fatality, 1 year ago. And 1 year later, we've had 7,821 of our Connecticut neighbors have passed away. So it's a remembrance of what a year it's been and how we're coming out of it by staying together. And speaking about getting out of this, on a more positive note, here's the vaccine update. And, we're moving in on 2/3 of our people, the most vulnerable, 55 and above, have had their first dose. Overwhelming majority of the folks, 75 and above, up just a tick or two since last time. 65 to 74, 3/4 of them have been vaccinated. And we've gone from, 40 to 46% of the folks 55 to 64. And it's worth noting, Josh was checking again this morning. There were appointments open, often on the pharmacy sites. So for those 55 to 64, here's your last chance perhaps to book an appointment because, as you know, tomorrow we're opening up to the next age group, which is, the 45-year-olds and above. Today, we've had about 33%, 1/3 of all of our adults have received their first dose. And that's an important note. And next time we talk, we'll have over 1 million of our folks have received their first dose. This next chart I thought was pretty interesting. It shows you how long it took and what the pickup was on the different age groups. If we had about a month for the 75 and aboves, that's because we had many fewer vaccines then. And, we're close to 80% of them have been vaccinated now. 65 to 74-year-olds, that was about 350,000 people. That took a little over 3 weeks. The next age group, 55 to 64, that was about 500,000, and that took a little less than 3 weeks. So what's going on is as we get these younger age groups, we're able to do it faster. We're getting a lot more vaccines. And also it does appear that there may be a slightly lower take rate as well. 45 to 54-year-olds, that's 475,000. That's a lot of people. But, about a quarter of them have already been vaccinated because we've prioritized our healthcare workers, our educators. They fall into that category. So for the next 2 weeks, 45 to 54. And I think you can see that there's a ramp up and then it tails off a little bit. And, frankly, the other reason there's a blend here as we move from age group to age group, because in some of our communities, 2/3 of the people 55 to 64 have been vaccinated. In others, maybe it's just a third in some of our cities. And we want to make sure there's no vaccine left on the shelf. And that's why we've moved into the next age category tomorrow. The other thing we're doing tomorrow is expanding our capacity. We can talk about that a little bit. Our restaurants, I was at the main pub today in Manchester. They've been doing it well. All the plexiglass, maintaining the social distancing, wearing of the mask, and 8-person table capacity, 11 p.m. curfew, but 100% capacity. Rather than go to 75 or 85%, which is what some other states are doing, very difficult to enforce. And the main pub and our other great restaurants have earned the right to get up to 100% capacity. Same as we're doing with libraries, museums, aquariums, gyms, fitness centers. Continue to wear the mask in those gyms and fitness centers, a lot of breathing. Retail offices, personal services, nail, hair, and houses of worship. So tomorrow is a big day. And I want you to make sure that while we're opening, keep your caution, pop your head in, make sure that restaurant is maintaining the protocols so you feel comfortable going back indoors. Movie theaters and performing arts, keeping them at 50% capacity for a little bit longer, just because they tend to be a bigger crowd in movie theaters. Maybe you're eating and sitting in close proximity to somebody for maybe 2 hours at a time. Other things when it comes to reopening tomorrow, just as a reminder, we've been through this before with David Lamont. Indoor private parties, 25 people, up from 10. Still be careful. Obviously, if you're with people who have been vaccinated, you know them pretty well, you can relax a little bit more. If there are people you don't know as well, continue to be careful. 100 outdoors for those private events. Obviously, outdoors much safer. Commercial venues, maybe you've got a caterer there at a commercial venue, 100 indoors, 200 outdoors, 11 p.m. curfew. Sports are going again now, and the travel advisory starting tomorrow is now an advisory. It's not a mandate. But still, if you've been vaccinated, you have a lot of flexibility when you fly back and forth. If you've been down there in Miami Beach and you've had a party and you have not been vaccinated, I want you to test. And I want you to quarantine when you come back. I've seen what some of those parties are, and they could be super spreader events, so please be careful. Just one other thing before I introduce Albert is the PPE. Remember where we were a year ago? Remember all that talk about the stockpile in Washington? There was no stockpile in Washington. You know, thankfully our hospitals and some of our nursing homes had a bit of a stockpile. You know, Josh and his team scoured the globe, and you can see that we purchased about 327 million pieces of PPE, mainly masks, gowns, gloves. We used, about a third of it. We have 200 million pieces right now to make sure we're never caught short. Make sure that we're way ahead of the curve going forward. And that just gives you an idea of one of our new master facilities. We're not going to count on Washington for the stockpile. We're going to count on ourselves. And finally, in introduction to Dr. Ko, a couple of things just to think a little bit about the vaccine immunity. He can talk a little bit about some of the testing they're doing in Yale, New Haven, what that's meant in terms of the immunity. Seems to carry over for at least a year. That's very good news. And just a reminder that the vaccine works. We've had a year of experience with it. We've had hundreds of millions of vaccinations have done. And we know from the nursing home experience that it's brought down fatalities and hospitalizations to close to zero. What a difference that makes. Albert, welcome back. It's good to see you again.
Thank you very much, Governor, for the opportunity to come back and to join you in this press conference. So I'd like to just make 3 points and to highlight some of the comments that you had made earlier in your presentation. I think the first one is really starting out with the good news, and that was that the CDC report that was done as a collaboration between the Department of Public Health and Yale University that showed that a single dose of the vaccine actually provided significant protection on the order of 60% to nursing home residents. And we know from other studies done in Israel and in Europe, as well as the United States, that initial dose, does provide a level of infection that's important in keeping our communities safe. And it highlights success stories on several fronts. First this is the collaboration between the Department of Public Health and Yale throughout this pandemic. This particular study was led by Vivian Leung from DPH and my colleague, Sunil Parikh. And it also justified the rapid rollout and the prioritization of nursing homes that really protected our nursing home residents during that initial surge. And it also underscores kind of the hard work that the Department of Public Health had done before even those vaccines were rolled out with respect to mass vaccine testing, control, COVID recovery units that were set up throughout this state, which actually ensured that we didn't repeat what happened in the first surge when we had our second surge in November, December, and January. So the second comment is to place a cautionary note that we're not clear of COVID at the present, and I'm actually concerned about what will happen or may happen in the next weeks or months. We know that these variants of concern, the UK variant, the South African variant, and now the Brazilian variant, have been detected in the state. And these variants are more transmissible, and at least from what we know at this moment, the UK variant, which we call B117, is actually more virulent and is actually can cause higher risk of mortality and hospitalizations. And we've seen, as the governor has said, that it's caused this third wave in Europe and required lockdown. Paris just announced today that we were going to go lockdown for 1 month. And we really can't repeat the mistakes that we've experienced in the United States and other states have gone in reopening too quickly and prematurely, and such as in Florida, Texas, among others, and also relaxing the face mask restrictions, which we know are important in preventing transmission. So cautious approach to reopening, as the Connecticut is doing, with continued use of face masks, avoiding the large gatherings, which actually drive super spreading and transmission is going to be key. So let me end up on the last point, which is the good news, which is that although we are in this race against time with these new variants and the potential public health threat that they pose, we're making really important progress on vaccination. I would not have expected, and this has far exceeded my expectations, that 80% of the population over 75 would be vaccinated at this point. And it seems like we're on track for all the other age groups that are following to reach that goal of 80%. 80% is important because that's when we're going to start seeing population level benefits of vaccination. And that's, I think, really to the credit of this age-based rollout, which makes complete sense with respect to protecting those most vulnerable to the severe effects of COVID, whether it's hospitalizations and deaths, and getting the vaccine out as quick as possible. Any mass public health campaign needs to be implemented as simply as possible and as quickly as possible. And we can't forget also, in parallel, that those large impacts of the pandemic that has been experienced by our underserved communities. So in parallel to these broad horizontal campaigns, which is getting the vaccine to as many people as quickly, we have to, and as the state is planning, as DPH is carefully implementing with local health departments, with the healthcare systems, is to increase vaccine access and promote vaccination in our underserved communities, those communities with highest vulnerability, social vulnerability. So with that, let me stop, and thank you again, Governor, for inviting me back for this press conference.
Albert's sticking around. Josh and Paul, any questions?
Channel 3 Eyewitness News.
Yes, I guess my first question will be for Dr. Ko, based off of what you just said. How concerned should we be with the New York variant? And do you see it threatening our reopening, not necessarily for tomorrow, but maybe in the weeks to come?
Yeah, so I am concerned about the New York variants. There are two sets of variants. Those are variants where we have good evidence, scientific evidence, that they're more transmissible and that they, in some cases, are more virulent. And those are the UK variant, the South African variant, the Brazilian variant. There are two more that made the list. And those are variants from California that are present in our state, but they haven't taken off like the UK variant, which is replacing all other strains very quickly. The New York variant, we're still learning about those. They have spread, so we suspect that they may be transmissible. We're really waiting for good epidemiological evidence that in fact is the case. What's particularly concerning about the UK variant is they harbor certain mutations that may enable escape from the immune response, either the immune response elicited by having a COVID infection in the first place, in increasing the risk of reinfection, or potentially our vaccines. And I think one tenet that we have to really follow by is that a virus can't needs to replicate in order to mutate. And the best way to prevent that replication and mutation And to prevent these vaccine escape mutants from occurring is to decrease transmission and to control transmission.
Got it. And so, Governor, based off of what Dr. Ko said, when it comes to our daily positivity rate, is there a percentage that you're going to be looking at going forward in these next few weeks?
A little less involved in the positivity percentage, a lot more concerned about hospitalizations. That would give us a better idea of whether this highly infectious strain that is a possibility in New York that you and Albert were just talking about, whether that's impacting our hospitalizations and our capacity. So I think that's going to be number one. Right now, our hospitalizations continue to stay low because the most vulnerable in our population are getting vaccinated fast.
And should we have reason to believe it is in our state right now?
Oh, absolutely. Not like it is in Texas or Florida or some other places, but there is clear evidence that, in particular, the UK variant is here and spreading, and that the vaccine works against it.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. Just following up with Dr. Ko, what you were talking about, the various concerns that you have right now with the virus. So with that as the background, is tomorrow the right day to lift these capacity limits in the state?
Okay, so as the governor said, our hospitalization rates, they've kind of plateaued. They've gone down and they've plateaued out. We've also had decreases in the number of our cases. And so, I think the answer to this is what's happening in terms of getting vaccinations. It is a race against time in getting vaccinations ramped up. Let me make two caveats of what I said before. The first one is that we know we're certainly concerned about what we think are vaccine escape mutants. We still need more evidence to understand whether certain variants actually can escape the vaccine. We know that, for example, the South African variant, there may be lower, protection confirmed by vaccines against, in preventing mild disease. But actually, this is the case with the J&J vaccine, which was just recently licensed, it was actually quite effective in preventing deaths and hospitalizations. In the end of the game, the key issue here is going to be preventing really the severe morbidity and the mortality caused by COVID. So getting the vaccine out to those people who are most at risk at death, the elderly, those with underlying medical conditions, is going to be key in this race against time against these variants.
Thank you. And to the governor, I know we're just about 8 hours or so away from eligibility reopening or opening to another age group. I know you in the past have really stressed patience to those people who are looking to sign up, but can you help set some expectations for people either logging on tonight at midnight or early in the morning tomorrow about, are there going to be appointments available and how far out might they be finding them?
They may be finding them out, 2 or 3 weeks. That's true. And Matt, as you know, at the beginning of every new age cohort, as they come on, there tends to be a rush. That's why I always urge patience, and I particularly urge patience of those who perhaps don't have the same level of risk as other people. Let those that can't telecommute, those who are forward-facing, those that maybe have some sort of a condition they think maybe puts them more at risk. You're self-certifying, but give them a little bit of space. We're going to have plenty of vaccines for everybody in this age cohort over the course of the next couple of weeks, and we're going to have plenty of vaccines for everybody starting in less than a month.
Okay, thank you.
News 8.
Governor, once we get to tomorrow and we open up to 45 and over, how many people approximately are we talking? Is it 300,000 or 400,000?
Let's see. I think I had that number. Do you have that right in front of you, Josh?
Yes. So it's 477,000 people in the state. But keep in mind, about 90,000 of them have already been vaccinated, and we know that quite a few other people, may have some hesitancy, may not be rushing out tomorrow. Our estimate is probably about 200,000 people will be looking to queue up in this next phase who haven't already been vaccinated.
And for Dr. Ko, some of the Hartford Healthcare announced yesterday, and as is Yale in the past, that they will give people the choice which vaccine they want. Do you think in a way that having that choice in the minds of the people who are not sure they want to get the vaccine, that this might kind of put them over the edge and get them to be vaccinated, just having that choice?
Yeah, so let me start out with the evidence and the science and what we know about these three vaccines. We know that these vaccines are all safe with respect to, they have an excellent safety profile with very rare serious adverse reactions, 1 in a million for the three licensed vaccines, the Moderna, the Pfizer, and the J&J vaccines. In terms of the effectiveness of these vaccines, when it really comes to matter in terms of hospitalizations, severe outcomes, they all work, equally well. So bottom line is that, again, not to presume for each of the healthcare systems, but at least from where the evidence stands, these vaccines are equitable in that the most important thing is getting them out to people and not getting into issues that would complicate potentially the successful rollout in vaccination of large proportions of our population.
Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. My first question is going to be for Dr. Ko. You mentioned you've been following some studies in Europe and talked about how Paris, for example, had to revert and announce a lockdown today. Do we know what did they do wrong, and do we face the possibility of a similar fate?
Yeah, so thank you for that question. And I think we have to remember that each country, each state is in a very different situation, in a very different public health and epidemiological situation. One of the big issues in Europe, and this is alluded to by the governor, is that vaccination in much of Europe has been held up or going slowly, much slower than certainly what we're experiencing here in the United States, and slower than much far lower than vaccination rates than what we're seeing, what the state of Connecticut is implementing at this moment. So the issue with France is that they haven't been able to roll out the vaccine program. The first goal of any vaccination program is to protect those most vulnerable for death and hospitalizations. They were not able to do that. And now they're in a situation where they have to kind of play catch up. They've reopened too quickly after an initial surge, at the end of last year during the early winter, and now having to lock down again. And they don't have that protective coverage. Now, here in Connecticut, we've got that, or we're getting towards that, especially, certainly among the age groups over 75, over 65. So we may still have, because of these variants and the UK variant, transmission in the community. We still may have cases. But, I think the good news is that because of those high vaccination rates in those over 75s, over 65s, we're going to have protection against hospitalizations and deaths.
Thank you. And then, Governor, could you talk about the preparations being made to be ready for the big day, April 5th, when everyone over the age of 16 can sign up?
Yeah, the main preparations are, I want to get the 45 and above, get them in line, make sure they get vaccinated. Obviously, they're much more vulnerable than the younger populations. Josh has been working with the hospitals and the healthcare providers so they can reach out to the most vulnerable. He may want to speak to that a little bit. And we're building up the capacity, and most importantly, working really closely with the COVID task force and Jeff Zients. It looks like we're going to get a lot more vaccine by early April, a lot more J&J in particular. So not only are we opening up to a wider group of people, we're going to have a lot more supply by then. Josh, anything to add to that?
No, that's right. As you alluded to, Governor, a number of the chief medical officers at some of our hospitals and community health centers have been talking about, what would be the appropriate, relatively limited list of conditions that are at particularly high risk among younger people that they may want to bring in earlier in that next phase. And then we're also working with Commissioner Sheff and the team at the Department of Developmental Services to set up some dedicated clinics in that first week of March 5th when we open up for people with intellectual and developmental disabilities, likely at DDS facilities around the state. So we'll have more information on both of those topics as we get closer to April 5th.
News 12 Connecticut.
Hi, Governor. Any scenario you can imagine where you might have to dial up the restaurant restrictions again, kind of like phase 2.1 last year?
John, you know me, I sure hope not. I mean, most other states, they started, they stopped, they opened the bars, they closed the bars. We've tried to be as consistent as we possibly could. And so we waited before we opened up restaurants and other, retail and the such at 100%. I'd like to think, that we've turned the corner. We're only going to be able to vaccinate more and more people. That gives us more and more confidence that we've made the right decision. But you're right. If this variant ends up catching on fire, or people come back from Miami and they bring a, infectious strain with them, we'll do what it takes in terms of putting public health first. But I don't think that's going to happen.
Connecticut is getting a lot of money from the new American Rescue Plan. This week, the Connecticut House voted to take oversight of that money. I know your office negotiated that agreement with them, but I'm just curious, are you worried that might tie your hands any or leave you without enough flexibility?
No, we have a good relationship there. I was talking to some of the leaders this afternoon. We're talking to all the leaders by early next week, saying this is a big pot of federal money when it comes to the federal, when it comes to what we have for the state, what we have for the municipalities, what we have for education. And let's not spread it around like peanut butter. Let's find what are the big programs you want to do that will be transformational and make a difference. And I'd like the legislature involved in that. As Paul can tell you, we have an agreement, per the bill you just saw that says we'll present you a plan by the end of April that you can opine on as we go through the normal appropriations process. But I want you involved earlier. I mean, today I was on with superintendents and teachers from across the state and something called Accelerate Connecticut, saying, what do we do for the kids? How do we get them back into school for the final 3 months of the school year? Because we have 100,000 plus that haven't been there. And more importantly, or just as importantly, what do we do starting in, after July 4th to make sure the kids are ready for September? Anything to add to that, Paul?
No, I think one thing I would just add, Governor, is some people might call it oversight. We say codifying the process that we've always been doing. We've always said that the legislature needs to be involved. They are the eyes and ears on the grounds in their particular communities. But the one thing the governor is challenging not only the legislature, but our municipalities and our school leaders is this is a time to be transformational. This is a time to think big. We are blessed to not be in certain situations like other states where they have to use a majority of that state and local aid to basically take care of their general fund, their budget. So we're going to be looking at this. We're putting together various groups within our administration led by myself, Josh Jabal, and Secretary McCall, setting up subgroups within it so we can make sure that we're not only coming up with ideas about how to spend the funding, but we're also coming up with guidance for our municipalities and our school districts about how we can truly be transformational here in the state.
All right, thanks, Paul. And just one off-topic question for you, Governor. A few weeks ago, I had to ask you about Governor Cuomo. At the time, you said, let's let the investigation play out. But I want to touch base with you again on that because since then, we're now up to 7 women accusing Governor Cuomo of sexual misconduct. There's a potential criminal investigation. And this week, even the president said if the accusations are true, he should resign and maybe even be prosecuted. So I'll just ask you again, given all that, what is your position today? Should Governor Cuomo resign?
I think it's the same as I said before, John, and I think as the president said accurately, if the accusations are true, people are innocent until proven guilty, but I'm glad there's an independent investigation going on. I think they should do it expeditiously so that New York can get on and governing itself going forward. So I think we ought to have some clarity on this. I'd like to think in the next few weeks or shorter. I think it's important.
All right, thanks, Governor.
WTIC 1080 News.
Hi, Dr. Coe. 73% of all new cases in France are of the British variant. Is that related also to the lack of the slow vaccinations?
Let's see, Dave, I didn't hear the figure. You said
73% of new cases in France are of the British variety.
Yeah, so the emergence of the UK variant in France, there's several drivers of that. First of all was human movement and travel between UK and France. Regions of France that got hit hard first were the ones which were just right across the channel from the UK. The second driver was really they opened up quickly, and then they had the social contact or fueled and drive transmission. The third, as you said, was the vaccine. Now the vaccination. The good news on all of this is that we've gotten very good evidence from the UK, as well as Denmark and Israel, that the vaccines that we're using here in the United States are going to be effective against that UK variant. So that again gets back to the point that vaccination is going to be the key to controlling that threat by the variant.
Thank you. And Paul Mounds, off topic, the casino deal, how did that come together at the end?
I think it came together like the whole process did. Everyone got around the table. Everyone put their cards on the table. When we got pencils down, we all came to an agreement. I think it all started with the leadership of this governor, empowering his team to negotiate the best deal on behalf of the people of Connecticut. And I keep saying this over and over, and I've been saying this around in our office and to our team. This is something that's not only transformational, it's not been done ever by the state of Connecticut, just the overall totality of what this gaming agreement means, not only now, but into the future. This governor fought very hard, and we got to an agreement with our tribal partners. And I think I think there's been a lot of football references thrown out there, but I'll use one from Bill Belichick. Now we're on to the legislature. We're on to now get this passed through the legislative process and make the case there, and then we'll be on to the interior. But overall, it was a good day for the state of Connecticut, and it really shows under the leadership of this governor what can be achieved.
Thanks.
Bill Belichick said now on to the legislature?
He said on to New England. He said on to Cincinnati. Come on, man.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Good afternoon, Governor. I understand that your administration's meeting today with the Democratic leaders, that you're considering possibly having the entire General Assembly, not just that committee of leaders, to vote on a plan to extend some of your executive powers beyond the 20th. Could you please explain what your administration is recommending and why?
Yeah, that was... Nora thought, look, it'd be better if the whole legislature wanted to opine rather than just the subcommittee of the leaders. We pointed out that, look, there's a variety of things in those emergency orders that are really important to continue. One, maintain the emergency declarations so we continue to get 100% FEMA reimbursement. That's kind of important in terms of funding. Number two, as you heard from Albert Coe, we're not necessarily done with vaccinations on April 20th. There could be variants. There could be booster shots. We could have a vaccine available by later this summer for our kids under the age 16 and under. So we need to maintain some maneuverability there. But we're talking to leadership on both sides of the aisle to find the right way to go forward. But it won't be open-ended as it was before, but still give us some of that maneuverability so we can keep you safe.
Any idea of how long that period would last?
I think it depends on some of the emergency orders. But as I said before, it could be that we're doing vaccinations for younger people, 16 and under, into the fall. So it won't be broad-based, but on some emergency orders, we'd like to have the flexibility to keep them going a little bit longer.
Thanks for that. And just for Dr. Coe, just to clarify, you're okay with what the state is planning to do tomorrow in terms of reopening even more?
So I think there are two important points. I think the worst case scenario we can do going forth is what's happening in many other states in the U.S. where they're letting it fly or hang out, and in lifting face mask restrictions, lifting all social gatherings, keeping bars opening. We know those have been really kind of the pressure points or the touch points of transmission in the past. I think the second thing is that the state has always been, I've had the privilege of working with DPH, has really been, very evidence-based. Keeping a close eye on hospitalizations, deaths, but also cases and testing. And I think one good example is the wastewater surveillance, projects there. So there is a close calibration between policy and evidence. That rests. I am concerned. That's not to say that I'm not concerned about these variants. I work in Brazil and working with a team with PAHO and the Brazilian Ministry of Health and local health officials, where there's a humanitarian crisis occurring there at this moment because of spread in transmission of their Brazilian P1 variant, with intensive care units overflowing, people getting intubated in the halls. So my opinion, my personal viewpoints are tempered by those experiences. But the state is really, I think throughout the epidemic, whether it's the nursing homes, whether it's getting up testing in our underserved communities, have really been relied on that close calibration of evidence and triggers and policies. So I'm confident that's going to get us through this next potential threat. And it's, again, let me say this is a potential threat, but it's one that we have to be prepared for.
Is it a gamble then to open up capacity like this?
I wouldn't call it a gamble. And again, there's a risk, involved. And just remember where we were at, last May, on May 20th, when we opened up, we went from phase 0 to phase 1, with the Reopen Connecticut committee. We're making projections on top of uncertainties. And we've learned a lot since that point about, I think the reopening strategy that was put in place by the governor, back in May, has carried us through in terms of really understanding the risks and benefits, and that kind of close calibration. Phase 2.1 is another good example of how the evidence can help drive decisions in pulling back and pulling forward. But I wouldn't necessarily call it a gamble. I think there's close surveillance and monitoring of this, so that's going to mitigate any risks made by any particular set of programs or policies.
Thank you, Doctor. Thank you, everyone.
Let me just add that there's no such thing as 100%. As Albert said, we had to start reopening. We did it on May 20th. And some people said that's early, wait, delay, whatever. And for the next, 8-9 months, our infection rate went down as we cautiously reopened. And I think now here we are cautiously reopening again as of what we're going to try and do tomorrow. And as Albert said, we have capacities. So if something changed dramatically, if it started impacting our hospitals, we have the ability to change course. But right now, I think, given the vaccinations, where we are and powering through, this is the right decision at the right time. Now wear the mask.
Thanks so much.
Next.
The Waterbury Republican American.
Thanks very much. I'd just like to follow up real quickly on a question I asked last week about nursing home visitation guidance. The CMS has, obviously issued its updated guidelines. Any idea when the Connecticut Department of Public Health might be issuing some sort of update?
Josh?
Well, we always follow the CMS, the federal regulations, and I believe the Department of Public Health is is on top of that. There may be some additional updates as they cascade them down, but the CMS guidelines are what we all follow.
Okay, and I was looking at the numbers, the weekly report on the high SBI zip codes, the priority zip codes. It still looks like, in terms of percentage, it's twice as many fully vaccinated folks in the other zip code category. Is that a concern? Are we making enough progress in terms of addressing the racial and ethnic inequities or disparities?
I think we're making progress. I don't think we're making enough progress. Governor, every time we meet, we're talking about, what more we can do to get additional resources into communities that are behind in terms of vaccination rates. And there's a lot of great work going on in those communities right now, ranging from mobile vaccination clinics and churches and senior housing and community centers. More and more people now out literally canvassing, going door to door. Education and trusted messenger programs that are being rolled out, outbound calling into underserved communities, reserving appointment slots at the larger vaccination sites for people who live in those zip codes. And we're meeting every day, talking about what we can do, and I think we'll have even more to roll out as soon as next week with additional supports. So there's more work to be done. We have been making progress, and we appreciate all of the local partnerships. These have to be community-led from the ground up, and we're very grateful for all the hard work that's going on in these communities, and we're continuing to do everything we can at the state level to help push that forward even further.
And Dr. Coe, where would you say Connecticut stands in terms of the pandemic? Are we heading towards the end? Are we getting closer to the end? Is it just the beginning of the end, the middle of the end?
Yeah, so I think I think the key issue here is going to be the vaccination and how we can get our large swaths of our population vaccinated, so we can witness or experience those population level benefits. So we're on a good track in terms of protecting our elderly, most at risk from dying. The next big, goal is to get those rates up, not just for the over 75s and the, over 65 populations, but more broadly. I think we're on a good course in that. Certainly Connecticut is one of the best states in the union in terms of their coverage. Second of all, I think the foundational tracks or the infrastructure to do this, to make this a long, sustained response, is there. Remembering that we're, once these vaccines, are approved for use in children, less than 16, that's another swath of the population that have to be vaccinated, and so we're going to get there. My own personal feeling, and there's, hopefully I'm going to, the timelines are going to be, more rapid than my projections, but I'm thinking about fall, where we're seeing large amounts of our population vaccinated, so we can see those population level benefits and we can really see the control. I think, let me just stress one other thing that's important and why we're different now than we were, for example, back in May when we opened Connecticut. We vaccinated the people most at risk for dying from this disease. That's the nursing homes, and that's our elderly population. So that goes a long way. And that also differentiates us from, for example, Europe, which is being affected by the UK variant and that emergence. So I think there are many good signs, encouraging signs, and I think most importantly, the infrastructure to make this a sustained program rather than a one-shot is all being laid out.
Okay, and just one final question for me for the governor, just to follow up on John Craven's question. Are you saying that Governor Cuomo should resign if the allegations against him are substantiated or criminal charges are filed against him?
I'm saying let's see what the investigation shows. Let's do it quickly so we can get on to a good governance in New York.
But should he resign or not?
Again, Paul, I think people are innocent until proven guilty. That's why you have an independent investigation, and I think it started. I think they're interviewing most of the witnesses, the women. I think we're going to get their point of view loud and clear, and then we'll be able to make a clear-eyed determination. That's up to the people of New York and the governor.
Okay, thanks very much.
Thanks.
The Day of New London.
Hello, Governor. I wanted to follow up on the gaming agreement again. So I wanted to ask that during the negotiations, was everything in the tribal compacts on the table? Was there much discussion of that 25% state share of the slots revenue? As you know, Foxwoods has been having trouble in recent months meeting that threshold and having to make additional payments. And also, I just wanted to ask what your sense is of where the legislature is on it. Do you expect that that'll sail through this agreement?
Yeah, Brian, two good questions. No, first of all, no. We thought that the compact was working for the tribes in the state of Connecticut. We didn't really want to fool with that when it came to the slots and the 25%. We worked off of that as a base, two good partners going back to the early 1990s. I think it's going to do very well in the legislature. The legislature had, some other bills on there that would not have advantaged the state of Connecticut nearly as much. And I think people are sort of happy with the way this has come out. I'm really happy that Rodney and James are on board and together. And Paul is talking to some of the other players here in the state to make sure we have a really good Connecticut-wide solution that gets our state and gaming and sports betting into the 21st century. Look, the world is going virtual. And we got to make sure that our gaming competes there as well.
Thank you.
The Hartford Current.
Hi, Governor. Following up on the emergency powers question, do you have a little more of an exact date for when you want them to be extended to? And do you aim to hold on to all of them or just a handful of them and let others expire?
Yeah. No, not all of them, just some of them that are really required to help us through the end of this pandemic. I think I talked about the emergency resolution and a real focus on vaccinations. How long? Look, probably the legislature doesn't want to give a carte blanche and a green light for a long period of time. Perhaps they want to do something that they can renew or narrow, on a regular, every 30 days or 60 days. But I think everybody does understand that when it comes to some of the decisions we've got to make to get us through this safely, and it's not over yet, as you've heard from Albert Coe, we need some more time.
I'll also add, Governor, in addition to that, in terms of various research we've done, it's important to have emergency declaration to ensure that we have federal funding and be eligible for various federal funding opportunities. So we're going to be working very closely with the legislators. We're going to provide them a full legal background. We're going to give them a sense of what are the executive orders that are important to move forward in order for our various departments and our partners to be able to address this pandemic as we still go through it. But we're going to work very closely with the legislative leaders on that front. And there is a good introductory discussion with the leaders, and we will have a bipartisan discussion in the coming weeks.
Thank you. And data show that COVID-19 cases and death rates have significantly declined among the state's oldest residents. Governor, do you see that being due to vaccinations alone or to other factors as well? And do you expect to see some similar trend among younger age groups as eligibility expands and they are increasingly vaccinated?
Yeah, I do, Eliza. I mean, we saw how successful the vaccinations were in the nursing homes. And I think you're seeing those same trends in the 75 and above because they've been overwhelmingly vaccinated, a group where, 85% of our fatalities took place. So that's why we really focused on age. That's where the complications are. So I think you're going to continue to see a downward trend, not necessarily in infections, but I think in hospitalizations and fatalities. And that's our key metric going forward.
Thanks. And one last question. Is the state doing anything in particular to prepare for increased calls and online registrations for vaccine appointments tomorrow?
Yeah, as you know, during the last tranche, we got a lot more people on board to answer phones. We got expanded bandwidth for those who are feel confident doing all this online. I know our pharma partners and federally qualified health centers, they're ready.
Thanks very much.
Hearst, Connecticut Media.
Thanks, Governor. The first one's for you. If the vaccination numbers are good enough that we can open up for everyone in early April, why are people still having trouble finding appointments?
Peter, because as soon as it opens up, everybody runs to the door at the same time, and it's going to take, for this age group, starting tomorrow, 45 and above, a couple of weeks. As we found out, there's a rush at the beginning, then there might be some room at the end. You're saying maybe some of the 55-year-olds are still having, some problems getting the vaccine. But in other communities, we got 2/3, 70% of that age group vaccinated, and there were openings as early as this morning for vaccinations within the next week. So that's the balance we're trying to reach.
Yeah, our one of our most important goals in this vaccination program is that we never want to see a vaccine appointment go unused. So as you saw from that chart the governor showed earlier, as we go to each phase and it ramps up, I mean, we're literally forecasting it out day by day, anticipating when you're going to start to get to those points where appointment slots would go unused, because that's the point you want to move to the next phase. Now, that means some people will have to wait a little longer to get their appointment, but it helps ensure as a state we're getting shots into arms as quickly as we can, and we're not letting appointments go unused, which is really the goal. But it does require some patience from people as we transition from phase to phase, as the governor said, and we'll certainly see that tomorrow. There'll be a lot of people out hunting for appointments that won't be able to find them tomorrow, but we'll be able to find them over the next couple of weeks.
Thanks. And then, are you aware of people shopping around for one vaccine or another? Or do we have any stats on that? And is DPH going to say where you can get one shot over another, or is that being withheld?
We've asked all providers since J&J came out to make sure that it's clear in the registration process which vaccine is being provided associated with that appointment. We want people to have that full transparency and be able, if they have a preference, to be able to make that choice. The good news is, anecdotally, from our providers, we've been hearing that most people are, as Dr. Ko said, understand that these vaccines are all outstanding in terms of their safety and efficacy and are grabbing the first slot they can find. But we are providing that information.
Okay, because I was on VAMS and I had a hard time figuring out who was providing what. So do we know if people have walked away from appointments based on not being able to get J&J, for example?
I've not heard of that happening. I've actually heard a lot of people want J&J specifically. They like that one shot and you're fully vaccinated aspect of it. So,
I had one more for Dr. Ko. With younger people, around 20 to 50, seem to be having a bit more cases crop up. Looking at the state's data, are you at all concerned about that with lifting capacity limits tomorrow? And how does the vaccine play into this?
Yeah, so we've seen that trend. Thank you for the question, Peter. And we've seen that trend, happen as of last summer, where we had a shift in transmission from the older age groups to the younger age groups, and so this has just been a kind of a continuum of that the underlying epidemiology, where we're seeing actually, the groups that are probably most important in terms of transmission are going to be the young adults, 20 to 29-year-olds, and perhaps some of the older adolescents, or and certainly the group that's going to colleges. So what does that mean, and how do we address that from the public health perspective? So I think there's two things. One is that opening up, moving toward that April 5th date, or the date where we can vaccinate large swaths of our population. And as Josh had just mentioned, getting vaccines into the arms of as many people as quickly as possible is going to be key. The second thing is that that's going to make also more efficient any of the interventions in our underserved communities, those communities with high social vulnerability. You can imagine the difficulty or complexity if you have to go twice, if you have to go to a community once to vaccinate people over 45 years of age, and then have to go back down again to vaccinate people who are in lower age groups. And I think the third part, which is going to be key, is until we get out of the woods, is again, following the state guidance on face mask use, gathering sizes, maintaining physical distancing, those things that we've known worked for us. Vaccines have done a lot and are going to do a lot for us in terms of decreased mortality and morbidity in the elderly. But really, a lot of the things that the state, many things that the state had implemented really got us out of the woods, in that second surge. We're already coming down on that second surge because of phase 2.1, because of face mask use, before vaccines started kicking in. So we know those things work, and we're going to have to keep on doing part of those, and particularly the face masks are going to be key.
Thank you.
Connecticut Public Media.
Piggybacking on several other reporters' questions, speaking on NBC's Today Show, Dr. Fauci said that if public health measures are lifted when there's still high background dynamics of virus in the community, there's a risk that we're going to rebound exactly like what's happening in Europe. So just want your response to that as we go forward and open up a little bit more tomorrow.
I'll start. Our infection rate's been very stable for the last 3, 4, 5 weeks. That gives us a great deal of confidence. Unlike Europe, our people are, look, if Italy's got 6 or 8% of their people vaccinated, we got a third have their first vaccine shot. So I think it's two very different situations, but Dr. Koh keeps us vigilant every day.
The Connecticut Mirror.
Thanks, Max. Dr. Koh, does the presence of these COVID variants increase the potential for vaccinated people to be asymptomatic carriers?
So I think we're learning each day something, and we have to also be, and myself, specifically has to be humble about, what we know today may not be true tomorrow, but I think in general, what we're learning about about the vaccines is that they are actually effective in preventing infections. They're effective also in those people who get infected and have been vaccinated in lowering their viral load. And that viral load is important because that's what's needed to kind of transmit from one to another. And I think there's actually quite a bit of new evidence that's coming out that needs to be confirmed, but that these vaccines may have actually, because of that decrease in the viral load, because of the protection against infection, may have that transmission blocking potential. And that's something that's kind of the dream for any public health official, in the sense that we get a vaccine that does what, for example, the perfect vaccine we have is, or close to perfect vaccine we have is that of measles, and as well as polio. And I think there are good signs, at least from the evidence that's preliminary evidence coming out now, that may be the case, that we can actually reduce, if not infections, we can reduce the ability of one person who's vaccinated transmitting the virus to another person.
Thank you. Just one quick follow-up, though. You were talking just a few minutes ago about the importance of masks, and you're also just said we're still learning as we deal with these variants. New ones keep cropping up. I know, this is very unscientific. I'm seeing, as I go shopping, I'm amazed at the number of elderly people not wearing masks, just saying, I'm vaccinated. So they're wearing it around their neck, which of course does nothing. How quickly, you called these, these gatherings, mass gatherings, super spreaders. How quickly could things go bad, though, if we get the wrong variant present in Connecticut? We have mass gatherings.
Sure.
We get asymptomatic carriers.
Yeah, no, and again, I think much of this at this point is speculation, and we don't have large amount. Well, first of all, these vaccine escape mutants. Certainly, we're concerned about that situation with the South African variant. Again, as I mentioned before, although they may escape, these vaccine escape mutants, the South African variant may cause infection and may cause disease. What we're seeing, at least in the trials, and this was the J&J trial, and this is the new Novavax trial, that they actually prevented hospitalizations and deaths. So going back to kind of the basic principles, we use vaccinations for two ways. One is to protect people from dying and being hospitalized, and the other is to get that herd immunity effect, where we can block transmission. There's the vaccination, at least at this point, we don't see any threats with the variants in terms of reducing the effectiveness of these vaccines to preventing deaths and hospitalizations. Now, we're going to be learning a lot more. As I mentioned before, I'm working in Brazil, and we're particularly concerned about that P1 variant there and whether that may be the case there. But these are still all hypothetical issues. They may happen. We need to be prepared about them. But I think there's no cause for alarm. I think the other issue that you did mention is that people saying that they're vaccinated and they're safe so that they can restrict to go off restrictions. Well, see, we are learning certain things about it, and that led to the most recent CDC guidances on vaccinated people and allowing vaccinated people to congregate without use of face masks. But that certainly is not true for the general population, and we still need to be cautious on that and await further evidence.
Just last quick follow-up, Dr. Ko. Was there a case of the Brazilian COVID variant diagnosed in the New Haven area?
Yes, there was. The first case in the state, as far as I know, there's only been one, has been detected here in the state of Connecticut.
But it was in the New Haven area?
Yes, it's in New Haven County.
Thank you.
CT News Junkie.
Thanks. Governor, I wanted to follow up real quick on the executive power thing. If I understood you correctly, you said that Nora Danahy, your legal counsel, had advised that it might be a good idea to have the whole legislature approve at this time. What changed along those lines?
I'm not sure what changed, but we've continued this once, through the committee process, and she just thought if we can get the legislature to weigh in and say, given vaccinations, given some of the other imperatives out there, if they would all weigh in and state this, it would probably be clearer. It especially when it comes to the emergency declaration, what that means for FEMA.
So it wasn't a response to any court opinion or decision or anything like that, do you know?
And probably lends a little more clarity given that opinion, sure.
Okay, is it safe to assume that the face mask requirement and the social distancing requirements will be among the things you use to extend under this?
Well, again, I think we'll have some recommendations. We'll make that a little closer to April 20th. But, my instinct is I want to get kids back in the classroom. So I think I'd probably recommend the kids keep wearing the mask, at least through the end of the school year. Those are the type of things the legislature may have a point of view on.
No, I guess I mean if you do extend your declaration, will you use it to extend the mask requirement as well?
For example, in schools, yes.
Okay.
We'll figure out what we do beyond that.
Right. And who all was at this meeting? Was it the Democratic leaders?
Yeah, today was the Democratic leaders, but more importantly, we're meeting with all the leaders first thing next week.
Okay, thank you. And I had one more question, might be a Josh or Paul question. To what extent have state employees come back into the office, the ones that were able to work from home, let's say during the pandemic? Has there been any sort of directive or encouragement to get folks back in the office, or has that not occurred?
Well, since last summer, our guidance to commissioners has been that we need to be operating the state at full capacity, full productivity. And I believe our teams have done a fantastic job doing that under very challenging circumstances. As the governor said previously, we still have COVID out in the community. We still have a lot of people who haven't yet been vaccinated. And so he's, urged all kind of office employees to use caution, continue to telecommute when they can. And we're following that advice within the state. But at the same time, we're fulfilling our mission and making sure that all of our agencies are getting the job done every day.
Okay. Has there been any discussion of maybe changing that or asking them to come back in, or is that still at this stage in the game not really a consideration?
If it's required to get the job done, then yes. But we've been extremely productive with a lot of telecommuting over the last year to help mitigate contact and reduce risk for our employees and for the general community. And we'll continue to follow that approach for now.
All right. Thanks, everybody.
All right, I think that's about it. So Albert Coe is back by popular demand, and as we move into March Madness season and NCAA basketball championships, the UConn men's basketball team is in the draw, and they are back by popular demand as well. They should be. They had some injuries earlier in the season. Now they're playing really well. They are going to be a surprise contender. No surprise, UConn women's team, #1 in the country, as well they should be. And they are playing better and better and better. So we're looking forward to them surging forward. And finally, UHart, University of Hartford men's basketball team. They're in March Madness as well. That's the first time in a generation. That's progress. I hope they're there to stay. Thanks, everybody.